Using a recumbent bicycle after surgery is very simple, but there are a few things to think about. The first thing you want to do when you get onto the bicycle is put your healthy leg, the side where you did not have a surgery, into the stirrup. When you put that, fully extend your leg, you should have a slight bend in your knee. You do not want to be hyperextended because then your foot will probably fall out of the pedal, and you don't want to be so close that your knee doesn't straighten out at all. So on the side where you did not have surgery, put your toes into the stirrup, push it away, and have a slight bend in your knee. If this were the side where I did have my operation, what I would do is a little bit different. Again, I would push that pedal as far away as possible, but instead of putting my toes in the stirrup, I'm going to put my heel on the top of the stirrup. That way, when I pedal, my calf muscle will not get stretched and my knee will remain a little bit looser. So then on the other side, the side where I did not have the surgery, my toes go into the stirrup normally. So on the operative side, my heel goes in the stirrup. On the non-operative side, my toes go into the stirrup. Initially, when pedaling on a recumbent bicycle after surgery, it's a little bit easier to pedal backwards. That's because I get more motion from my hip instead of getting all the motion from my knee like I do when I pedal forward. So pedaling backwards initially is easier. When you begin pedaling, you don't need to force it to go all the way around. So if I'm pedaling back here, my knee starts to get very tight, I hold it there for a moment. I get a stretch, and then I pedal in the opposite direction. Same thing when I'm pedaling forward. I bring it back as far as I can. If that becomes too tight or too painful, I stop there, I hold it, I let my tissue stretch for a moment, and then I pedal back the opposite direction. As I do that and I hold those end range stretches, my knee will loosen up to the point where eventually I feel as though I can go all the way around. The other thing that helps when you're pedaling initially is to point your toes. So rather than having my toes pulled up like I normally would, I point my toes down as if I'm pointing my toes across the room. That will take the stretch out of my calf muscle, which keeps my knee looser, which may afford me some extra range of motion. Again, I'm not forcing it into sharp pain or beyond what I'm comfortable doing. I'm just going to that end range that I can tolerate. I hold it there, let it stretch, and then go in the opposite direction. Eventually, I'll feel as though my knee is loosened up enough that I can go all the way around. And then what I'll do is pedal in that direction for several minutes, maybe 2 to 3 minutes, as my knee loosens up. After that starts to feel a little bit easy, then what I'll try to do is to pedal forward, which again, I may not get all the way around on the first time, so I come back and get a stretch, and then eventually I'll feel loose enough that I can pedal all the way around forward, still pointing my toes forward to keep my knee loose. As my knee loosens up, I may start to pull my toes up as I normally would when I pedal a bicycle. And then the last modification is to go from pedaling with my heel in the stirrup to putting my toes in the stirrup, which will be more demanding on my knee. So again, I may pedal backwards initially, and once my knee loosens up, I'll then pedal forward. So in review, it's going to be easiest to pedal with the heel in the stirrup, to point my toes forward, and to go backwards. As I loosen up, I progress to pedaling forward, to putting my toes in the stirrup, and then to pulling my toes up as I pedal.